Great. I'm here with Chief Health Officer Dr Hugh Heggie to provide an update for Territorians. There was 14 new cases of COVID-19 in the Northern Territory overnight, and I'll go through those details now because I know that they'll be of significant interest to Territorians, particularly in some areas. 11 of those cases are linked to the current cluster, and the total case count for that cluster is 123 cases. And I'll go through the 11 cases that are linked to the cluster to provide some more details. 2 of those cases were linked to Katherine East, and those 2 individuals were household contacts of previous cases, and they have been at the Centre for National Resilience, so a very low risk to the community. They've been in the Centre for National Resilience for their infectious period. One of them is a child under 10 and one of them is a teenager. There was 9 cases in the Tennant Creek area, and I'll just provide some details on those cases to help people understand. There was a 46-year-old woman and a child under 10. They were identified as early close contacts, and they have been isolating in Tennant Creek since they were tested, and we are confident that they haven't been out and about in the community during their infectious period, and we'll now work through a plan to care for them. As we've seen throughout these Tennant Creek cases, some people have been going to Alice Springs, some up to the CNR. 2 children under 5, and they're from the Whopper camp, and they tested positive whilst in CNR, so they were part of the cohort that was moved over the weekend. There's a child under 10 and a woman in the 20s, and they're both close contacts of the people that were identified as testing positive yesterday from the Walkabout Bore outstation, which was near Barrow Creek. And those cases, as I just said, were reported on yesterday, and they are now at the Todd facility in Alice Springs, those 2 cases. We also have a woman in her 50s who is a close contact of one of the previous Tennant Creek cases. And we have 2 women, both in their 60s, who are both in RDH. One of them is in intensive care, as I understand. The other one has some underlying health issues, and so for that reason she's being cared for in RDH. So that is the cases linked to the cluster. We also additionally in the Territory have 3 cases that are not linked to the current cluster. One of them is a close contact from the 2 Yalara cases. So those were the individuals that flew from Brisbane to Yalara, were notified upon arrival in Yalara that they were close contacts, and they then tested positive, and they had a number of close contacts that were moved to the CNR. This case is a male in his 30s. He is in the Centre for National Resilience. There was a number of people that were moved to CNR. The genomic sequencing has confirmed that the 2 initial Yalara cases are Omicron, so we strongly suspect that this case will also be Omicron. So the work is being undertaken now, that genomic sequencing around that. So just confirming that those 2 Yalara cases that came from Brisbane are Omicron, and we now have a 3rd case, but we're yet to finalise which strain of the virus it is. We also have an international aircrew member who flew on the London-Darwin flight QF2. He was isolating and following those protocols, so very low risk to the community and has tested positive. And finally, we have a woman from Adelaide who recently arrived into the Northern Territory. She was not fully vaccinated, so therefore she immediately went to the Centre for National Resilience. She then returned to South Australia, but in the meantime her test result has come through that she is positive, and so we've notified the South Australian authorities of that case, so she has already left the Northern Territory. So that is the case summaries for today. I'll just provide a brief bit of information around testing and what's happening across the Northern Territory. Then Dr Heggie will make a comment, and we're both happy to take questions. I don't have the overall territory-wide figure for testing in the last 24 hours, but I've been informed that it has been a strong rate of testing, and particularly in Katherine and Tennant Creek. So there was 280 tests done in Tennant Creek, and I think that's one of our biggest days yet in Tennant Creek. So well done to everybody in Tennant Creek for coming forward and getting tested. And there were more than 200 tests done in Katherine. So thank you to the residents of Katherine. Even though they're out of the lockout and the mask mandate, it's still really important to come forward if you are feeling any signs of illness in the Katherine region. The vaccination numbers are strong. but we would like to see them higher in the Barkly particularly. So I again reiterate, vaccination is so important. There's no questions asked about why you perhaps have left your first dose to this point. Our health professionals simply want to protect you from COVID-19. So if it's your first dose, your second dose or your booster shot, please come forward around making sure that you protect yourself and your community. Even getting vaccination now will provide you with some protection as we see COVID move around the Northern Territory. And I'd also just like to acknowledge Ali Kurrung. They had 54 doses of the vaccine delivered through till about 5 o'clock last night, so that is fantastic. There's about 350, 400 people in Ali Kurrung, so to see 50 people come forward and get vaccinated, that is fantastic. So that certainly pushes up their first dose coverage. And we need to see people being vaccinated, particularly in the Barkly, as we have to make some decisions over the coming days between lockdowns and lockouts and mask mandates. If we see that vaccination rate coming up, as we did in Katherine, it gives us confidence there's protection in the community. I'd just like to talk about close contact, well, exposure sites, in the Northern Territory. People should check the NTG website, the COVID-19 website. Just because there's none being loaded doesn't mean that work isn't being undertaken. So we're going to amend that to have a statement to let people know. Most of these cases are household contacts, and so through both household contacts and going back and looking at CCTV footage, we've been able to identify all of the contacts, but we do have 2 close contacts from these cases and the cases over the past few days. The Way Out Bush store at Tea Tree is listed as a casual contact site, and that's on December 17th between 8 and 10 p.m. And also the Shell Coles Express Alice Springs truck stop in Breitling is a casual contact site from 12 to 2 p.m. And I don't have that date, so I'll make sure I get that so that we can inform the community. So if you've been to any of those locations, it's a casual contact, so please follow the advice, which is immediately travel by private transport to your home or suitable accommodation, self-quarantine, contact the COVID-19 hotline, identify yourself as a casual contact so that we can arrange that testing, and you do need to remain in isolation until you've received a negative test. And even once you've received that negative test, please be conscious of your personal health. If you develop any symptoms at all, please contact the authorities. And just in closing my comments, I just want to address some of the waiting times for test results. I certainly can acknowledge it's frustrating for individuals once they've had that test to then have to wait to get that test result. And we are hearing from the community that they've had to wait quite a long period for some test results. We're getting through large numbers. We're specifically focused on our close contacts and getting those test results that we expect to be positive, but we don't think it's acceptable that the community should wait days and days for a test result when then they've done their bit in getting tested. So we are working on that. It's not our laboratory. We can deal with thousands of tests a day. It's around the systems that support that. And we're seeing right across the country right now significant testing times, and it can certainly be challenging for people. So for some people that might be arriving into the Northern Territory, they would have gone and got their test perhaps 60 to 70 hours before their departure, and they still haven't got it as they land in the Territory. What we're doing is please show our border control people that you have had the test, so a message saying you booked in for the test. We are then booking you in for an appointment here in the Territory and allowing you to go to your place of residence or where you may be staying to isolate, go and get the test in the Territory. If you do receive your negative result from interstate in the meantime, you're free to move about the community, and I would suggest you keep that appointment that's been made for you so you can meet your criteria of being tested within the first 72 hours. So we are being reactive on our borders, acknowledging that interstate we're seeing significant testing delays, and as I just spoke of, we're also experiencing that here in the Territory, and we're trying to overcome that. So we have got that, and in some cases they may do a RAT test, so our teams are being agile. We're seeing significant numbers of people arrive back into the Territory, which is of course what we expected with the border changes from December 20. Just to reassure the community, we do have a strong testing regime, we do need people to be vaccinated, and there's other public health measures that can be put in place, and our teams on the borders are ensuring that all of this happens. So we're seeing about 2/3 of people fly into the Territory through our airports, and about 1/3 come across the road borders. I just want to finally flag around Tennant Creek. We still have We need to see people getting vaccinated in that Barkly region. We really need to see that. We won't make a decision about the lockdown until early tomorrow afternoon. We need to see the testing, we need to see the vaccination information coming through to help us make that decision. We will SEMSI a little later tomorrow. We have a National Cabinet meeting which the Chief Minister will participate in, and so it's anticipated that we'll provide our daily update to Territorians in the early afternoon once National Cabinet and SEMSI have both been held. So just to forewarn people about that tomorrow. I'll now hand to Dr. Heggie. Thank you.
Thank you, Minister. And it was wonderful to see images of people being reunited with family and friends. And that's a wonderful thing leading up to Christmas. I want to also say that we expected there would be some teething problems as we opened our borders in the way we have. But I want to note that we actually have some of the strongest controls in the country. For those people who have open borders, that is. So we are going to look at the future and what it means for people who are needing testing and facilitate the results, getting back to them. But be rest assured that the positive results come to my attention very, very quickly after they've been validated. So again, what we're looking at the moment is really the Delta pandemic and its spread with relatively small numbers, but for us, where people go to, that creates exposure sites, and where they stay creates close contacts. So a lot of work done again overnight with text messages coming to me through the night and people working to do that contact tracing. Now, this is the Delta pandemic and a Delta outbreak, and yes, we've seen it spread to further sites than we thought. All I can say is that people need to consider their movements at the moment, who they mix with, and also the comfort and the safety that you might get from the principles which I've outlined before, which is in situations where you can't socially distance from people you don't know or haven't seen for a long time, the wearing of a mask is one of the most primary protections that you can get. Certainly staying away from others when you are unwell and get a test. We'll see, as I said before, colds and flu coming because travel across the world is occurring. Vaccination is the thing that will actually protect you from serious harm and to hospital admission. But having said that, it takes a while for antibodies in your blood after you've had the first dose to start to rise. So it doesn't mean that after that dose you have immediate protection. The second dose, that stimulates the immune system to produce more antibodies that will actually destroy the virus. The booster, again, boosts the immune system again, and we're looking at evidence from other countries and locally about the timing of boosters. I mentioned briefly the other day about the vaccination for the younger persons. They don't tend to get sick, but they certainly can spread. So at the moment, anybody that has any symptoms or has concerns about if they may have been somewhere where there have been cases, and especially if you've got symptoms, and we know that sometimes they are a bit obscure, like diarrhoea, and that strange thing of a loss of sense of smell or a cough. So the protection of the community, this is really important because we will have Omicron in the future, and what you're seeing at the moment is the way that we will respond. That's quick, agile, focused on close contacts and our approach to them. I will say, though, that it does seem that the Omicron is as infectious as measles, but nowhere near as virulent as in causing harm. So I think this is the way into the future. And rest assured, there might be some public health measures that are required from time to time, including the wearing of masks in certain situations, like large gatherings or indoor events, and that might be required in a particular area. We're actually streamlining our directions, so there's no delay in getting that information out, no delay in getting exposure sites up to the website. And I ask you all to be mindful, again, of those that you mix with, particularly the people who are coming and will be coming through our community. And no matter where you are, you cannot assume that there actually is no Delta around you. Thank you.
Just very quickly, you said there are 11 new cases today, 9 in the Katherine cluster, and then 3 more. So is that 12 new cases or 11?
So there's 14 new cases, 11 of them are linked to the current cluster, and then 3 cases, the Yalara, the Qantas crew and the person that returned to South Australia.
That person that returned to South Australia, is that proof that your border requirements work?
So I think, that you have to be double vaccinated to enter the Northern Territory. We know that vaccination is a tool to keeping our community safe, and that individual had not complied with the Northern Territory's border controls, so they were intercepted at the airport, went to the Centre for National Resilience, and then they are free to leave the Northern Territory. They must immediately leave the Territory, and they return to South Australia.
Other jurisdictions have brought in rules around masks. There have been calls for rules around masks here in the Territory. We're actually lifting restrictions here, if you look at what happened in Katherine. And why is that, and what would it take for us to bring in a mask mandate?
So I'll provide a little bit of comment and then I might hand to our Cho. So here in the Northern Territory, we're in a different situation to other jurisdictions. We have got a lockdown in place where we know we've got COVID. You've just heard from the Cho about wearing a mask if you can't physically distance, particularly from those that you don't know in groups of people. We haven't ruled it out as a measure into the future. In terms of Katherine, they had gone a number of days without any community cases and without people being, in fact, I think it was weeks, out in the community. So we do need to be proportionate with our responses, but Territorians, I think, should expect over the coming days, weeks, that we will have to move to using masks as an important public health tool. So I'll just ask the Cho to provide a further comment.
Yes, thank you for the question. So we have in place mask wearing where there is risk. So it's based on risk, and in this case, where we've got some cases and also the potential for people who've gone to other locations where there are low vaccination rates, and in some cases very, very low vaccination rates. And the Commission and I went several months ago to talk to the communities about that. So it has to be defensible and it has to be proportionate. It has to be based on evidence and epidemiology. And that's the way we will approach it in the future. But if we were to have a large gathering here, then the risk of people who might not know that they're infected, we might actually have a requirement to have a mask mandate. Certainly for vulnerable settings, we know aged care and disability care, and also not just those facilities, but the people that you might actually interact with who are actually an older person, have illnesses and also disability. So you need to think about how you're going to approach those people if you come to visit them, and it may be that you wear a mask to go and visit them. So I think that we need to consider this as a basic fundamental tool that was long ago understood in the plague, and I think I've referenced that before. The Grim Reaper, it was indeed a mask, a primitive mask, when they didn't even know the bacteria that was the cause of the plague. So this is long-standing. Don't forget hand hygiene, because if you are exposed through fomites, and that's objects that might be infected with COVID-19, by touching your eyes or your mouth, you can actually get the infection yourself. So I think this is a really important principle that we need to remind ourselves of, and there may be occasions when that's very appropriate.
The Barrow Creek cases, how long were they in Alice Springs before being identified as positive?
I don't have that specifics, but they had travelled from Barrow Creek. They had attended hospital for another health reason. It was at that point that they were tested. So the contact tracing is underway and has been for the last 24 hours. We've seen 2 of their household contacts now test positive, but our teams will work to make sure that every exposure site is provided, and more importantly, those close contacts are notified so that before they potentially become infectious in the community, measures can be put in place.
What about the hospital itself? It doesn't look like that the part of the hospital that they visited has become an exposure site yet.
No, so in terms of our hospitals, they've had strong measures in place for people attending hospital really since the pandemic began. Everyone that enters our health facilities gets screened. It doesn't matter if it's a major tertiary institution such as the Alice Springs Hospital or a remote primary healthcare clinic. They have a screening process, masks are worn by staff. So yes, they have attended the hospital, but there's already public health measures to keep staff, patients and other visitors safe.
Are there close contacts of that case in Alice Springs Town Camp? Do you have that information?
I don't have that, but we're certainly working through. We have had numbers of close contacts. We don't provide their locations. It does concern us when we have people in large households with lots of visitors, and we've had someone that has been in those situations, but we work through the close contacts and there's the well-established protocols that come into play. Sorry, Tom?
We've heard reports that state leaders are pushing for booster doses to be made available to the population before 5 months now. That will be something that's brought up in National Cabinet tomorrow. Is the Chief Minister going to be among those who are going to be advocating that position tomorrow?
So we've seen the UK, I think it is, it's brought those booster doses down to a shorter time frame. There is advice that's discussed at ATAGI, AHPPC. I'll participate in a National Health Ministers meeting this afternoon. The Chief Minister will participate in National Cabinet. So all of the advice will be provided and then decisions will be made from there around making sure that we provide those vaccinations at an appropriate time frame that protect the community, but also ensure that we can adequately deliver it across the population.
How likely is it that the lockdowns in Tennant Creek and Ali Currong are going to be extended?
I really can't say. We really need that vaccination rate to come up, and we have seen, dozens of people come forward, but not the hundreds that we would expect. So we'll just be looking at the cases over the last 24 hours and making sure that all those close contacts have been identified. Do we have all of their test results? Those are the types of pieces of information that will help us make that decision tomorrow.
It was also revealed that there were some people that escaped from Tennant Creek at the checkpoint. Can you shed any light on that?
I don't have detail on that. I'd suggest you talk to NT Police.
We spoke to the opposition leader today who was concerned because they say the government doesn't have any idea about how many staff shortages there are at the RDH or in their hospitals, and they're concerned about the 3,500 travellers coming in over the holiday period every day, and they don't think our health system is going to be able to cope, get the response to them.
If you want to talk about who has no idea, it's the Leader of the Opposition. She would have opened our borders last year in June. She would have given away our vaccine. So when it comes to credibility, the CLP have absolutely none in the health space. We have continued to listen to the health advice. We've got a number of public health measures in place to keep our community safe. As we step forward into the new normal, as we go from a pandemic to an endemic, there will certainly be challenges, but it's not that we're just throwing open our borders like the CLP would have done. We have got vaccination, we've got people coming in and having to follow a testing regime.
But to that point, do you think you will be able to handle the outbreak?
Absolutely. We have kept Territorians safe to date and we will continue to do so. We have managed this response very well right across the Northern Territory, dealing with a particularly vulnerable population. We've got some of the highest vaccination rates in Australia in some areas. We certainly acknowledge others we're working on and we need people to come forward. There's plenty of vaccine available. But we have listened to the health advice, we have put in place measures to keep the community safe, and now we're entering this new phase where we do need to acknowledge that we can't stay cut off forever. We do need people to be able to travel, and we've got those public health measures to keep people safe as we do so.
Why can't the NT government tell us how many vacancies there are for doctors and nurses in our hospitals?
So right across the Northern Territory we have a complex health system. We have 80 remote healthcare clinics, we have 6 hospitals. We've always acknowledged that staffing is a challenge and we've got a number of measures in place to grow our own staff, to support staff. But I can absolutely assure Territorians that throughout the pandemic we've kept them safe and we'll continue to do so over the coming weeks and months.
There's 14 cases today. A lot of people at home will probably be wondering why the Chief Minister isn't providing this update. Where is the Chief Minister?
Oh, we've already been over this. You'll see the opposition, you'll see government members. I hope that every Territorian gets a chance to take a break over the Christmas-January period to spend time with their loved ones, with their family. I'll certainly be doing so. The Chief Minister is keeping in touch with the team and he'll be back speaking to Territorians. But I think it is important that we all look after our own physical and mental health, and people have worked very hard right across the Territory, and I hope each one of us is able to take that time with our family over the coming days and weeks.
So is he still on last time?
Yes, but he will be participating in National Cabinet, and as I just said, he has kept in touch with the team, and I think that we've got our Cho, the Acting Chief Minister, and myself. We have kept Territorians informed of the changing situation, and it will continue to evolve. It will continue to change over the coming days and weeks. COVID is here. We need to learn to live with it, and we'll certainly make sure Territorians are kept updated. Thank you.